Good morning. Welcome to the coordination presentation. My name is Mary Mutheki, and I am the nurse manager here at Stockton Community Center. Today's objective is to discuss the fundamental principles of care coordination and effective strategies for collaborating with patients and their families to achieve desired health outcomes. I will also discuss the elements of change management that directly impact patient experience, which is necessary to deliver high-quality patient-centered care, and describe the justification for coordinated care plans based on ethical decisions. Finally, I will identify the potential impact of specific healthcare policy provisions on outcome and patient experiences. Let's now look at fundamental principles of care coordination. Care coordination is the intentional coordination of patient care tasks between two or more people, including the patient, participating in the patient's care to facilitate adequate healthcare services, as discussed by Karam et al. 2021. Care coordination is a powerful way to improve patient outcomes while reducing costs, and the nurse has a vital role to play. There are a few fundamentals to care coordination. According to Karam et al. 2021, a holistic approach to care, which addresses clinical and more general health determinants, is fundamental to care coordination. The patient navigation approach aims to connect patients and their families with community-based health and social services, specialists, and primary care to deliver comprehensive patient-centered care, as also discussed by Karam et al. 2021. A multidisciplinary primary team that works together as a coherent, cooperative unit to deliver the proper care in the right place at the right time is a crucial component of effective care coordination. Interventions in nurse-led care coordination have successfully enhanced access to adequate care while lowering costs, increased the safety of vulnerable patients during the transition, lowered unplanned readmissions to hospitals, and improved staff communication, as discussed by Karam et al. 2021. The care coordination should focus on the needs of the patient and family. It should also provide information to families and patients in a manner they can understand, as discussed by Karam et al. 2021. Therefore, strong communication skills are essential in helping with care coordination. Let us now look at effective collaborative strategies. Care coordination requires collaboration and communication between the primary care physician team leader, the care team, and the patient and family. To ensure care coordination delivers quality and efficient care, nurses must communicate with patients about their health and social status honestly and openly, as discussed by Karam et al. 2021. Honest communication help assess their needs and goals, enhancing trust and good relationship in the continuum of care. The nurse should communicate clearly and concisely and avoid using significant medical terms that can hinder the patient understanding. For instance, if a patient has a medication ordered, the nurse should communicate with the patient the name of the medication, considering if generic is the easiest way to communicate to the patient. Let the patient know the generic and the brand name, then the route, the frequency, and the next time the medication must be taken. The quality of care is enhanced when communication is streamlined between team members and no tests or procedures are repeated for no reason. According to Freeman 2019, the teach-back method effectively communicates with the patient and receives feedback on their understanding. Nurses should give the patient information and ask the patient to tell them in their own words how they understand the information. This ensures the nurse evaluates what needs to be repeated or emphasized in a different teaching method. The patient and family should receive written education materials to reinforce the teachings. Nurses sometimes may encounter barriers such as cultural differences while coordinating care. Having cultural competencies can help nurses become familiar with approaching different cultures. Care coordination helps reduce errors, provide continuity of care, improve the quality of care, and decrease healthcare costs, as discussed by Karam et al. 2021. Care coordination allows multidisciplinary teams to collaborate and provide a continuum of care to the patient. Good collaborative strategies help care coordination improve patient experience and patient satisfaction. To ensure effective collaboration, every care team member should understand their role. Processes that ensure collaboration, coordination, and communication between the primary care provider, care team, and the patient should be implemented. Our Stockton Community Center has systems in place to ensure communication is effective. Let's now look at aspects of change management. Change can cause a sense of loss and anxiety, and it can take time for patients to understand what the change means and commit to it. The Kubler-Ross change management model considers the psychological impact of change on patients, as discussed by Sale et al. In 2019. This model has 4 stages: denial, resistance, exploration, and commitment. In the first denial stage, the nurse communicates with patients about the new care plan processes and gives them ample time to prepare for the change because they have initially met it in disbelief. In the second stage of resistance, the patient experiences anger and blame emotions. In this stage, the nurse must acknowledge how the patient responds to change and make time to listen and empathize with them. In the third stage, the patient starts accepting change and exploring their role in the care plan. In this stage, the nurse should offer support, encouragement, and provide training. In the final stage, the patient commits to change, and the nurse should recognize and reward their efforts. Once patients embrace the new norm, adhere to the education, and feel their needs are met, they will feel satisfied with their care. Illness or injury indicates the patient's experience and can be affected by patient satisfaction with care. Both patient experience and patient satisfaction determine the quality of care. Therefore, nurses should address both while coordinating care. Coordinated care should be patient-centered. Let us now look at the rationale for coordinated care plans based on ethical decision making. Patients should be treated as their own persons and given the right to make their own decision so that we respect their autonomy. Nurses should respect patients' backgrounds and cultures while coordinating their care. Patients should be treated fairly, regardless of who or where they come from, and should have access to what they need. Care coordination should be done collaboratively as a team to achieve improved outcomes without causing any harm to the patient. Patients should be treated with kindness and compassion while planning for their care. Every nurse coordinates a care plan while applying the ethical principles of autonomy, justice, benefits, and non-maleficence. Coordinated care plans should allow a smooth transition across the healthcare continuum and should reduce errors and improve patient outcomes, as discussed by Karam et al. 2021. The nurse should discuss and specify all actions expected from each team member when developing a coordinated care plan, as discussed by Karam et al. 2021. When coordinating care plans, quality of care can be enhanced by streamlining communication between the care team members through secured email and respecting HIPAA law. Care team members can make decisions regarding patients' care plans on time if they can access information like diagnostic tests or lab results. The nurse should enhance the quality of life by addressing as many of the patient's health needs as possible. Now let us look at the impact of healthcare policy provisions. One government policy affecting care coordination is the Patient Protection and Affordable Act, also known as ACA. ACA was made into law in March 2020 under President Barack Obama. The ACA's three main goals are to increase patient access, improve the standard of service, and cut healthcare costs, as discussed by Collins and Sayer 2018. The government, through ACA, makes sure everyone has access to healthcare. ACA has three benefits. It makes health insurance more accessible and affordable. It ensures the type of coverage to help exit homelessness if you're experiencing it. And it focuses on the value and outcome of healthcare delivery. ACA helps every patient access quality care because the nurses ensure coordinated care is delivered to improve the outcomes, as discussed by Collins and Sayer 2018. Another government policy that affects patient care coordination is HIPAA, also known as Health Insurance Portability and Accountability Act of 1996. This is a federal law that mandates the development of national guidelines to prevent the disclosure of sensitive patient health information without the patient's knowledge or consent, as discussed by Health and Human Services website. The HIPAA privacy rules' main objective is to ensure that protected health information, which is also known as PHI, is appropriately safeguarded while enabling the flow of health information required to deliver and promote high-quality healthcare and to safeguard the general public's health and well-being. PHI is any information that can identify you, like date of birth, address, social security number, or phone number, or your diagnosis. HIPAA security rule provides technical guidance for PHI security. HIPAA guides agencies on how to use PHI. HIPAA does not prevent healthcare providers from sharing PHI between healthcare agencies which are offering patient care. PHI can be measured, analyzed, and used to provide quality and safety improvement in care coordination and healthcare delivery. As a result, the patient's care team can access patient's information in time and enhance the quality of care instead of delaying care to the patient. And now, in conclusion, I can say, as a nurse, you play a vital role in care coordination. You are the glue that makes everything stick together as a nurse. Play your role, and together we will deliver quality patient care. Thank you.